All right, welcome back, everybody. Thanks so much for joining us this morning. I'm Jayla Washington, and we've got a very special guest with us this morning. The United States is up to 8% of pregnancies that are considered high risk. So today we are joined by Dr. Kenneth Moise, the director of the Comprehensive Fetal Care Center at Dell Children, to share more on the importance of complex care for mothers with high-risk pregnancies. So first and foremost, thank you so much for being here, sir.
Thanks for having me.
Absolutely. So for people who might be wondering, what exactly is a high-risk pregnancy?
So I think there's two types of high-risk pregnancies. There's problems with the mom, so things like diabetes, hypertension, preterm labor. And then there's problems for the baby, the unborn baby that we take care of. That happens in about 1 in 33 pregnancies, where the baby has a problem like a birth defect that we can detect in utero by ultrasound.
It can be really scary for families who, are just wanting to build a family, and there are so many things that can go wrong. Can you share more about the Fetal Care Center and what it offers the community?
Right, so basically all pregnancies have an ultrasound around 20 weeks, and that's when sometimes what was a normal pregnancy now becomes a problem pregnancy because we'd find something. And many times these patients are referred to our fetal center at Dell Children's Medical Center, where we can begin to talk to the patient about what to expect. Sometimes we can do something for the baby. We can actually treat the baby surgically, but many times we're helping that patient meet the specialist that will take care of them after the baby's born at Dell Children's.
Okay. Now, why is there, I guess, a growing need for these services here in the Austin
Well, we
area?
have many more young people coming into Austin, and many of them of reproductive age, so they're having more pregnancies. And again, statistically, the rate of anomalies has not changed, so we still see 1 in 33 pregnancies having a problem. And so we need to have those resources. We used to have to send patients to Dallas or Houston in the greater Austin area. No longer the case. They can come to Dell Children's and get what they need.
Yeah. For families who might just be afraid to even ask questions or to, tap into some of those resources, what words of advice would you share with these families?
Well, I think they should talk with their physician. Obviously, patients are educating themselves more with Google and other types of online resources, but they should talk to their physician about where's the best place for their baby to be born so they have full access. We have a special delivery unit inside of Dell Children's Hospital that allows us to keep the mom and the baby together, so we don't have to separate the mom and the baby after mom gives birth.
Yeah, such an important topic, and just very, very important for families, like you said, to educate themselves and to tap into those resources. So, Dr. Kenneth Moise with Dell Children's, thank you so much for being here this morning.
Thanks for having me today.
Yeah, absolutely.